Many women with PCOS who are treating their condition with diet, exercise, and an insulin sensitizer ask, how do I know if I've restored ovulation? How do I know if I'm going to get pregnant? Well, normally to see if you ovulated, we'll be drawing blood tests, the progesterone, maybe an estrogen, or maybe doing ultrasound examinations. But this testing can be costly, and there's a far easier way for you to figure out what's going on in your menstrual cycle. And that's the basal body temperature chart. Basal body temperatures are a temperature that's taken first thing in the morning, before you even get out of bed, before you brush your teeth. It's important to have the thermometer lying at the side of the bed and take your temperature before you get up and leave the bed. You want to be sleeping for a period of about 3 to 4 hours minimum prior to checking your temperature. So take the temperature. You can record it on a chart that you'll find all over the internet, or you can go to a website like Fertility Friend, or Taking Charge of Your Fertility, or Ovusoft. These sites all have applications. Many of these applications now are available to load onto your phone to keep a record. And the nice thing about them is you can keep track of your temperature and share the chart with friends or with your physicians to have them review it and let you know if it appears that you've ovulated. Now, the temperature charts are easy to do, and once you ovulate, your temperature generally goes up about 1/2 degree to 1 degree. Prior to ovulation, you're going to find that the charting and temperatures are all over the place, and you can't really make heads or tails out of what's going on. But it's pretty clear once you ovulate, when you look at the pattern of temperatures, what's going on. Now, the temperature charts show whether or not you've ovulated, but for some women, they actually show a rise in temperature due to the rising progesterone values a day or so before ovulation. The majority of women will see this temperature rise occur shortly after ovulation is noted. So it's not really the best tool to let you determine when you're going to ovulate prospectively, so that you know when you and your partner should be together to achieve a pregnancy. The basal body temperature chart is a great tool to see whether you're ovulating. It's really less accurate when it comes to determining when you're going to ovulate and predicting that this is the correct day for you and your partner to have sex if you want to conceive. For some women, the temperatures go up the day or so before ovulation. In some, it may be a day or so after ovulation when the progesterone rises sufficiently to bring about a temperature change. I ask my patients when they're starting treatment with metformin to begin monitoring the temperature charts and bringing them to each of the visits. We may not see that the menstrual cycles are as short as they ought to be considered normal, but you may find that that temperature rise in each month is coming a bit earlier. And that's really a good prognostic sign that you're on the right track with your PCOS regimen.